Good morning. You all hear me?
Yes.
Great, all right. Good morning and welcome to the Caring Across Maryland press conference. My name is Ricara Jones. I am the political director for 1199 SEIU, United Healthcare Workers East. And we are the proud members of this newly launched coalition called Caring Across Maryland, which is a coalition of workers, patients, and advocates impacted by our fractured care infrastructure and dedicated to improving care in this great state of Maryland. The coalition includes groups that do amazing work like the Public Justice Center, AARP, Marylanders for Patient Rights, Jobs Opportunity Task Force, DC chapter of National Domestic Workers Alliance, and many more. I'd like to thank all of the partners who are here with us today as we announce our package of legislation that focuses on investing in quality care by increasing pay for direct care workers, improving oversight in our long-term care industry, and strengthening our home care workforce. The state's care infrastructure faces a number of challenges. Our aging population is set to explode 40% by 2030. We have the third longest wait list for home and community-based services and a short staffing crisis. The package of legislation is a critical step to addressing these issues. I just want to say a huge thank you to our amazing sponsors, Senator Rosa Pep, Delegate Henson, Senator Augustine, Delegate Kerr, Senator Bio, Delegate Bagnall, and Delegate Lewis. We truly appreciate your commitment to these issues. Today we're going to hear from two of our sponsors and hear firsthand from direct care workers in Maryland. I'm excited to welcome Senator Malcolm Augustine to talk about how we can protect quality care within skilled nursing facilities.
Thank you, Ricara. It's always great to be working with you. You're just such a tremendous champion for our healthcare workers. I'm really grateful for that. It's really an honor to work with such a broad coalition of workers, patients, and advocates to fight for a more caring long-term care system in the state. I am sponsoring the Bridging Ownership and Quality legislation with Delegate Ken Kerr, who is here. He's joined us here today. And this bill protects the quality of care of skilled nursing facilities in Maryland and requires our regulators to work together to put up some guardrails and prevent bad actors from practicing in the state. Private equity firms acquiring nursing homes has soared from 2010 to 2019, with estimated private equity deals totaling over $750 million. Residents of private equity-owned nursing homes were more likely to have emergency room visits or be hospitalized than residents of other for-profit homes. Now, in the last year, a dozen nursing homes have been acquired by new owners who have been flagged by the Maryland Healthcare Commission for a poor quality track record in other facilities they own. When nursing home owners go through the churn of new owners, they're always looking to cut costs, and often the first thing to get cut is staffing. We know that our care force is the backbone of our economy, so we must protect staffing so that our loved ones get the care they deserve. It's time to hold bad actors accountable and let Marylanders know that we will not allow putting our most vulnerable at risk of poor quality of care at the hands of profit-driven nursing homes. Now, I'd like to welcome Delegate Shanika Henson to talk about the importance of just wages for direct care workers.
Thank you, Mr. President Pro Tem, and thank you to Caring Across Maryland, all the coalition partners, and all of the care providers that are represented under that umbrella. I'm Delegate Shanika Henson, and I am honored to be working with all of the coalition members. I'm sponsoring the Maryland Medicaid Wage Pass-Through Act with Senator Rosa Pep. We know that direct care pay has historically remained low due to multiple factors. Those include underinvestment in long-term care services and the intersecting legacies of sexism, racism, and xenophobia. We know that has tended to undervalue the caregiving work that's being done by these dedicated professionals. The Maryland Medicaid Wage Pass-Through Act would increase Medicaid medical care provider reimbursement rates and allow the increase to be specifically designated for worker wages and benefits. In 2021, the average annual wage for nursing assistants in Maryland was just $34,000 annually. Staffing shortages are expected to grow as workers find better paying jobs in other industries. The staffing crisis in nursing homes is not new, unfortunately. In 2018, 2 years before the COVID-19 pandemic, PHI projected that the need for personal care for direct care workers would increase by 40% as Maryland's population continues to age. These impassable conditions mean that 1 in 5 certified nursing assistants are on public assistance, and 31% lack quality, affordable housing. This is absolutely an equity issue. Among certified nursing assistants, over 90% are women, and over half of them are people of color. New research from Leading Age at the University of Massachusetts, Boston, shows that raising the pay for direct care workers by just 15% would yield an impressive return on investment, which would include concrete benefits for a variety of stakeholders. Care recipients will have consistent and reliable care, workers could support themselves and find better financial security, and long-term service providers would see fewer staffing shortages, reduced turnover, and higher productivity. Simply put, I'm sponsoring this bill with Senator Rosapep because I believe that everyone deserves the opportunity to live well. These critical caregivers should not have to struggle to care for their own families on unlivable wages. Investing in quality care means investing in our care workforce. Thank you.
Thank you so much, Delegate Henson and Senator Augustine. We know that weeding out bad actors and investing in our care workforce is how we are going to strengthen our long-term care system. Our package of bills, it also includes 3 other bills that are focused on strengthening the home care workforce. As Delegate Henson mentioned, some direct care workers have the lowest wages in the industry. And while the need for home care services continues to rise, wages remain low and we have no idea what our workforce really looks like. One bill calls for a state oversight tool to understand the home care workforce by establishing a registry of all home care workers employed by residential service agencies. Our second bill aims to establish a wage floor of $16 an hour for home care workers. And our last bill works to prevent home care worker misclassification. I'm really glad that today Cynthia, Tari, and Crystal could join us and share their firsthand experiences as direct care workers and talk a little bit about how these pieces of legislation will impact them. Let's welcome Cynthia Neely, Tari White, and Crystal Kennedy.
Good afternoon, everybody. My name is Cynthia Neely. I am a CNA and a home care aide, and I love taking care of people. Unfortunately, I have to work multiple jobs as a caregiver to make ends meet. During the day, I work for an agency providing care to a sweet 11-year-old girl with spinal bifida while she attends Baltimore City Public Schools. I take care of her bodily needs, help her eat, and make sure she gets on and off the school bus, okay? I also work for agencies providing care for elderly clients in their homes, and I work in 2 different nursing homes. I work in multiple settings with different agencies just to make ends meet for me and my family and I, I'm sorry. The work gives me the opportunity to help people lead better lives, and that's why I do it. But there's a serious problem. The pay is too low. I make $16 for Baltimore City contracted, and being in a home with the elderly, I make $13 for veterans. The pay is low. At the nursing home, the staffing levels are inaccurate. Some nights they will be only 2 CNAs trying to provide care to 40 patients with major personal needs. We try our best, but we can't do everything these older patients need and deserve. It's so frustrating. They're not happy and their families are upset. I don't get paid time off or sick leave, and there's no worker compensation or unemployment coverage. When I didn't have a car, I would take the bus from one side of Baltimore City to the other to get to my next client, but we do not get paid for commuting either. Too often, agencies get away with wage and benefit theft simply by misclassifying us as independent contractors. That's why I am excited to support Senator Beadle and Delegate Lewis bill SB 180 to ensure residential service agencies hire us as full-time employees and give us the pay and benefits we deserve. It is unacceptable to treat the people who take care of our most vulnerable loved ones so badly. I'm out there every day as a caregiver, and I see clearly that caregivers in Maryland is headed to the wrong direction. Care workers power this state, and without us, everything will fall apart. I urge the Maryland General Assembly to take an action and pass these bills for more care and health care systems. Thank you.
Hello. Good afternoon. My name is Christelle Kennedy, and I work as a geriatric nursing assistant in Baltimore, Maryland. I am thrilled to be here today with my other coworkers and my advocates and our elected officials to fight for care workers and quality care for our patients. Providing care has always been something a part of my life since I was young. Growing up, my great-grandma would always take me to a nursing home to take care of our family members. My work is very personal to me, and I believe that we need better care infrastructures to ensure that we can take care of our loved ones with love, dignity, and support. I work over 60 hours a week, and my take-home pay is only about $800. This is barely enough to pay my rent or provide care for my own family. I am thankful to be here with Delegate Henson and also support Senator Rosa Papp as they fight for wage pass-through for direct care workers in nursing homes. Not only am I working long nights and hours, there are also a shortage of GNAs. While the standard should be one GNA to 15 patients, there are weeks where I'm taking care of about 25 patients. It was already bad, but the pandemic really burnt us out and showed us how little management really cares about us and our patients. We are overworked, understaffed, underpaid, and including that being risked at spreading COVID-19, all while trying to take care of our families and patients. It's not just nurses. Our housekeeping and our dietary staff are also understaffed, which causes longer wait times for rooms to get infected, and our meal times are impacted as well. They are also an important part of our care team. I have watched relatively healthy, independent patients come into the facility they are able to take care of their own needs decline due to management cutting staffing hours. Patients are dying and will continue to die in these heartbreaking and inhumane conditions if we continue to let our long-term care system put profit over people. And that's why care can't wait.
Good afternoon. My name is Tariq White. I spent over 30 years, I have over 30 years as a healthcare worker and a CNA and GNA. I'm also experienced too, as well as passing out meds. Today, I want to talk about, we don't get paid enough. CNAs, GNAs don't get paid enough. Especially on a night shift when you have residents of 40 or 41 as a census, and you only staff 2 GNAs. So that means there's 20 or 21 to each GNA. How can a resident get the best care when they are understaffed and that the facility don't care? If a patient needs to be repositioned every 2 hours to prevent bed sores, but you only have 2 GNAs, that's not good. We have family members that come at us, they fussing, they arguing, because they bring their loved ones in and expect care. And the reason why sometimes the care is not there, because the pay is not there for us. Some of us cannot make it off of $12.50, $13.50, and $16 is not enough for my fellow healthcare workers. I am asking, and I'm standing here, and I'm asking y'all please to fight for us. We need y'all. Healthcare across the line, we need y'all a lot. I hope our state officials will come into the facilities and see what's going on. It's time for our nursing facilities to improve staffing so we can provide good care to our patients around the clock. And I trust our legislators will stand with the workers like me and so many others, improve pay and benefit care. Can't wait. Thank you.
Thank you again, Cynthia, Tari, and Crystal for being here with us. Thank you for the work that you do. Thank you for sharing your stories. And thank you for the sacrifices that you make to care for our loved ones. The stories that you just heard, they are not unique to Maryland. This is an issue that's happening across the country. And we are joining a host of other states that are collectively saying care can't wait. Jamie Worker is an Associate Director of Policy and Advocacy at Caring Across Generations. And Jamie's here to talk with us about the nationwide care movement. Welcome, Jamie.
Thank you. I am thrilled to be here as in Annapolis as Marylanders embark on building a powerful movement for care. Care is the work that makes all other work possible. And Maryland will be joining several states around the country that have prioritized what we call care infrastructure. That includes paid family leave, child care, aging and disability care, all provided by a well-paid care workforce. Caring Across Generations is building a movement of the caring majority, people who are directly impacted by providing or receiving care, representing more than half of our country. We support care-focused policies both on the state and federal levels. And while we work to ensure federal dollars are going into home and community-based services for older adults and people with disabilities, we also know that the role of state governments is critical to support public investment needed for 21st century care infrastructure. So we see more than 10 states around the country using federal relief and recovery dollars to support permanent pay increases for direct care workers. States like Virginia have taken important first steps toward making sure direct care workers don't have to choose between their paycheck and coming to work sick or taking care of a family member. Most people want to be able to live and age in their own homes and communities, but aren't able to access the services that they need to do so. It is time for a new system of care that addresses the diverse and intersecting needs of our community. A system that is equitable and puts less strain on working families. We have to consider new solutions to finance this 21st century system of care to support Maryland's older adults and people with disabilities so that everyone can live and age with dignity. And by investing in care, the Maryland legislature will ensure people can access the care that they need at every stage of life. Family caregivers have the support that they need, and all care jobs are good jobs. And that's why care can't wait.
Thank you everyone for joining us for the Caring Across Maryland press conference. I want to thank again all of our speakers, Crystal, Tari, and Cynthia for joining us, sacrificing a work day to come share their personal stories. I want to thank our sponsors who came to speak, Senator Augustine and Delegate Henson, as well as all of our sponsors of our care package of bills, Delegate Lewis, Delegate Kerr, Senator Beidel, and Delegate Bagnall. We are building a care movement with the coalition Caring Across Maryland, and we want everyone to join. Caring is the backbone of our economy, and We need to make sure that this is a broad coalition of workers, of patients, of loved ones. So we really hope that you check out our website, www.caringacrossmaryland.com, to join the movement and really show Maryland Legislature that care must be our priority on the legislative agenda. So thank you again for joining us.
I have a question for Delegate Henson. You said, do you need federal approval for the Pass-Through Act? And Governor Moore is on the record saying he wants to raise the minimum wage this year to $15 an hour. If that is the case, would that help increase interest in passing the pass-through?
Thanks for the question, David. On the first part of that, there are other states who have already implemented similar measures as the bill would implement here in Maryland, and we do have the existing authority to do that. As it relates to the second part and our governor and his commitment to escalating our raise of the minimum wage, as it's been explained to me by some of the providers in this industry, it kind of has a hand-in-hand effect. As wages go up in other sectors, if we don't raise wages here, we have the potential of making it increasing the unemployment rates in this sector if we don't find balance there. So we'll make the need to raise wages here even more, because you could find a job paying the same amount at a different facility that doesn't require the same level of skill, expertise, hard work, and time in the industry. Thank you.
Maybe for one of the nurses or nurse assistants, that what you described is your work week with multiple locations, low pay. You're getting a lot of grief from other families, and I assume maybe you have your own family to take care of. Could you help characterize us, like, what it's like to try to get through a work week like that?
Well, once again, my name is Crystal Kennedy. I work as a geriatric nursing assistant in Baltimore, Maryland. I take my work very personal. Like I said, growing up, I'm only 25 years old, and I'm from the city. Growing up, I took care of my great-grandmother, my great-uncle, and my little brothers and sisters. So, working in a condition like that, you can do nothing but give your best, but at the same time, it's very taxing and stressing on our own mental health and our own physical health. Being that management, we don't really have management there to give us not only the support, but the necessity to take care of our residents and make sure that our residents are getting the same care that we would give our own personal loved ones. So the work week is pretty stressful. You getting out of bed and wondering, do you want to go to work? But then you had to, because if I don't go to work, they're going to be short. So yes, it's a pretty stressful work week, but you get it done if that's what you want to do. Like I said, once again, I take my work very personal.
I also think, so basically, what we're speaking about our experience on Monday, I actually was off for Baltimore City's public schools, and I went in to the nursing home because I don't work on those days and I don't get paid. So I went to the nursing home to get paid. When I go in there, I go 6:30 so I can start my day and start my assignment. Around 9 o'clock, they came and stated that we were short-staffed and they were gonna add me to another unit. By the time 3 o'clock came, all I wanted to do was take a shower because I was so frustrated and overwhelmed from being from one unit to the other, that when I got home, I really couldn't even help my youngest one with her homework. So it does put a lot of stress, it do put a lot of stress on you, and you be so frustrated in that type of environment that when you get home, all you wanna do is relax and look forward to the next day. So it's very stressful when you're underhand, yes.
Thank you guys.
Again, my name is Therese White. I'm 52 years old. It's very, very stressful. It's a lot of tan wear on our bodies, especially when facilities do not have the proper equipment to pour a 200 or 300 person up in the bed, or you have a Hoyer lifter that will not work. And so when you got 3 or 4 aides trying to lift someone up, and if that patient falls, then we all go to Concentra and get a drug test because we was trying to give the best care. And I have worked before in a facility where I did a 7 to 3 to a 3 to 11 shift, and it was only 2 aides to a census of 50 residents. So that means out the day and out the evening, I am working with 25 residents, and maybe 10 out of them are total care, which means that they can't do nothing for themselves. And you might have 2 that you might assist. And that meaning that you helping them go to the shower and redirecting them. And then you might, out of that care, you might have 3 that's dementia, but you don't even have a floor setting for the dementia. So it's very stressful. And it doesn't matter if you're 25, 35, or 65 doing this work. We need the help and we need a change. Amen.
Lawmakers, real quick, is there any protection in these bills to require long-term care facilities to increase the number of staffing? I'm hearing from multiple of the nurses up here that seems to be a major issue, is that they're not increasing staffing. So what I'm assuming from long-term care facilities is that if they're increasing wages, they may just respond by cutting down staffing to make sure that they're reaching their bottom line. Is there anything that forces these people to actually hire more staff?
Well, to that question, as Ms. Terry said in her statement, they won't hire any more staff. They'll bring in agency. Agency is put place in nursing homes. Agency is put place in our nursing homes so they will not have to give us the money as being independent contractors. We have some agency people that come in and make $35 an hour, standing next to somebody that only makes $20 an hour, that comes to work 7 days a week, 16-hour shifts, a census of 40 residents. And that does not include the treatment that we get. I work in a facility where I won't even get a cup of coffee for appreciation. And I work multiple floors, take care of multiple residents, and also do multiple jobs. So what they have in place for us, to answer that question, we don't really have nothing in place. But once this bill get passed, hopefully, in God praying, we will have something in place that will benefit us as independent contractors that are working underneath these workers and not an agency coming in and just doing nothing while we're working hard. Because when you have agency coming to the building, agency has the ability to tell you where they're gonna go, how they're gonna do it, and when they're gonna do it. Us independent workers, we don't have that, or we're getting rolled up, fired, or even got the Maryland State Board of Nursing could be called. So yes, hopefully when this bill gets passed, we'll have more of backbone and something to fall back on, to answer that question.
Ms. Kennedy articulated the spirit behind the bills very well, that they work together as a package, that because there are loopholes, there are ways for providers to not be accountable. That's when you get the type of disparity in wages that she described and the type of conditions that they have all described in the care facilities. But when you close those loopholes to perform the audit work, to make sure that the wages that we're sending are being implemented as we envision, it gives us more tools in our toolkit to come back with subsequent legislation. When you look at the legislation about making sure that we're not misclassifying workers, it disincentivizes bringing in those other contract workers when you know that you have to treat your existing workforce fairly and that we will be watching and holding care facilities accountable.
So Senator Augustine, it was your bill to hold these firms accountable. Would you explain a little bit, maybe piggyback on Delegate Henson, how does your legislation hold back bad actors accountable? You mentioned audits.
What it does is it connects. So we have 2 different entities that have responsibility for when there's a change of ownership. And what it does is it connects the quality data that's associated with the work that these actors have done in the past to those who have responsibility for granting licenses for people to purchase these entities. And so it's really a transparency thing such that we make sure that the information that is already there is getting into the right hands when people are making decisions about allowing some of these entities to purchase these home cares. And let me just say, these types of bad actors are ones who I hear from my constituents about, where they are doing some of the things that some of these care workers are talking about, where they are short staffing folks and not, looking only out for profit. And they have a track record actually of doing that. That's what we're trying to prevent having and happening here in the state of Maryland, is to say, listen, you have mistreated the workers, you've mistreated the patients in the past. We just don't want that here in this state. And so that's what this piece of legislation is set to do. and we are looking forward to getting it passed. Thank you. Thanks, everybody.
Thank you, thanks.
I want to get together for a photo real quick. Want to get together for a photo real quick? You can go back on stage for a photo real quick.